Welcome, everyone, to Only for Seniors. I'm Dr. Eric John, a physician here in the United States who has dedicated my career to helping seniors live not just longer, but healthier, fuller, and more independent lives. If you're 60 or older, this channel is your space, created just for you, where we dive deep into health, wellness, and the practical steps you can take to make every year after 60 a gift you can truly enjoy. Today, we're covering one of the most important topics for seniors, the 7 essential health screenings that every senior over 60 must get. These screenings aren't just about catching illnesses early, they're about giving you peace of mind, extending your quality of life, and helping you stay independent for as long as possible. Think of these screenings as your personal roadmap to better health. Because here's the truth, aging can bring new challenges, but with the right preventive care, many of the diseases we fear most, heart disease, diabetes, dementia, cancer, can be caught early or even prevented. So grab a cup of tea, sit back, and let's walk together through each of these 7 vital screenings, what they are, why they matter, when to get them, and how to talk to your doctor about them. Section 1. The importance of screenings after 60. Before we dive into the list, let's understand why screenings are so important. When we were younger, health seemed to take care of itself. Maybe you skipped doctor visits or brushed off small aches. But after 60, things change. Silent conditions, like high blood pressure, prediabetes, or even the early stages of cancer, often don't cause symptoms until they're serious. That's where screenings come in. They act like early warning systems. They help spot issues while they're still small, manageable, and treatable. In fact, studies from the CDC show that routine screenings can prevent up to 100,000 premature deaths each year in the U.S. And here's the encouraging part. These screenings are simple, accessible, and covered by Medicare and most insurance plans. So not only can they protect your health, but they also won't leave you with an overwhelming financial burden. Now let's get into the 7 essential screenings every senior should prioritize. Section 2. Screening number 1. Blood pressure and heart health. Heart disease is the leading cause of death in the United States, and seniors are at the highest risk. But here's the good news: high blood pressure, the main driver of heart disease, is easy to detect and manage. A simple blood pressure check, which takes less than a minute, can reveal a lot about your heart health. High blood pressure, often called the silent killer, rarely shows symptoms, but it quietly damages your arteries, heart, kidneys, and even your brain. Why it matters? High blood pressure can lead to strokes, heart attacks, kidney disease, and even dementia. Early detection means early treatment with lifestyle changes, medication, or both. When to get screened? Every year after 60, or more often if your doctor recommends. Many seniors benefit from home blood pressure monitors, which let you keep track between visits. Practical advice. Ask your doctor about your ideal blood pressure, since targets may differ for seniors. Keep a log of your readings to bring to appointments. Remember that Medicare covers annual wellness visits, including blood pressure checks. Section 3. Screening number 2. Cholesterol and blood tests. Your cholesterol levels and certain blood markers reveal important clues about your risk for heart disease, diabetes, and stroke. What's checked? LDL, bad cholesterol. HDL, good cholesterol. Triglycerides. Blood sugar, for diabetes risk. Why it matters? High cholesterol often has no symptoms, but it clogs arteries over time. Elevated blood sugar can signal diabetes or prediabetes. Combined, these issues raise your risk for heart attacks and strokes dramatically. When to get screened? Every 4 to 6 years if results are normal, but after 60, many doctors recommend yearly checks. If you already have heart disease, diabetes, or high blood pressure, you'll likely need tests more often. Practical advice. Ask your doctor about the lipid panel and fasting glucose or A1C. If your cholesterol is high, don't panic. many seniors manage it with diet, exercise, and medication. Keep in mind that Medicare covers cardiovascular blood screenings every 5 years, but many doctors recommend more frequent testing depending on your health. Section 4. Screening number 3. Diabetes. Diabetes affects nearly 12 million seniors in the U.S. It increases the risk of blindness, kidney disease, amputations, and dementia. But the real danger? Many seniors don't know they have it until it's advanced. The screening. A simple fasting blood glucose test or an A1C test, which gives an average of your blood sugar levels over the past 3 months. Why it matters? Diabetes caught early can often be managed without complications. Seniors with well-managed diabetes live longer, healthier lives and avoid disability. When to get screened? Every 3 years for seniors with normal results. Every year if you have risk factors like being overweight, having high blood pressure, or a family history of diabetes. Practical advice. Ask your doctor specifically for the A1C test. It's one of the most reliable. Watch for symptoms like frequent urination, unexplained weight loss, or unusual fatigue. Even mild diabetes requires close monitoring after 60. Section 5. Screening number 4. Cancer screenings. Cancer risk rises significantly after 60, but survival rates also improve dramatically when it's caught early. There are several key cancer screenings seniors should discuss with their doctor. Colorectal cancer. Recommended until age 75. Options include colonoscopy every 10 years, stool-based tests yearly, or less invasive screenings every few years. Breast cancer for women. Mammograms are recommended every 2 years between ages 50 to 74. Beyond 75, it depends on your health and doctor's advice. Prostate cancer for men. Discuss PSA testing with your doctor. It's not always routine, but men at higher risk may benefit. Lung cancer. Seniors with a long history of smoking may qualify for annual low-dose CT scans up to age 80. Why it matters? Early cancer detection saves lives. Screening can prevent cancer before it even develops, for example, removing polyps during a colonoscopy. Practical advice. Talk to your doctor about which screenings are right for your age and health. Medicare covers many cancer screenings, including mammograms, colonoscopies, and prostate exams. Don't skip these out of fear, they're about protection, not punishment. Section 6. Screening number 5. Bone density test. Falls and fractures are among the biggest threats to independence for seniors. Osteoporosis, thinning bones, often causes no symptoms until a fracture happens. The screening. A bone density test, often called a DEXA scan. It's painless and quick, measuring bone strength in the hip and spine. Why it matters? Seniors with osteoporosis have a much higher risk of hip fractures, which often lead to disability or loss of independence. With early detection, osteoporosis can be treated with medication, diet, exercise, and supplements. When to get screened? Women should start at 65. Men should ask their doctor starting at 70, or earlier if risk factors like smoking or family history are present. Practical advice. Medicare covers bone density testing every 2 years. If diagnosed, treatments today are highly effective at slowing bone loss. Section 7. Screening number 6. Vision and hearing tests. Our senses are windows to the world, and after 60, vision and hearing loss become more common. But here's the danger. Many seniors don't realize how much they've lost until it's severe. Vision tests. Screenings check for glaucoma, cataracts, macular degeneration, and diabetic eye disease. Early treatment can preserve vision for years. Hearing tests. A quick audiology exam can detect hearing loss. Untreated hearing loss is linked to dementia, depression, and social isolation. When to get screened? Every 1 to 2 years after 60, or sooner if you notice changes. Practical advice. Medicare doesn't cover routine eye exams, but it does cover treatment for eye diseases. Many community programs offer low-cost or free screenings. Don't ignore hearing aids. Modern ones are discreet and life-changing. Section 8. Screening number 7. Mental health and cognitive screenings. One of the most overlooked screenings is for mental health and brain health. Depression, anxiety, and cognitive decline are common but not a normal part of aging. The screening. Short questionnaires during your doctor's visit can check mood, memory, and thinking skills. Tests like the Mini-Cog or MoCA are quick, simple, and can spot early dementia. Why it matters. Seniors with untreated depression have worse physical health outcomes. Early detection of memory problems allows for planning, treatment, and support. When to get screened. At every annual wellness visit. Practical advice. Don't be afraid to bring up memory lapses or mood changes. Medicare covers yearly cognitive assessments. Stay socially engaged, exercise regularly, and challenge your brain. It's never too late to build mental resilience. Section 9. How to make screenings easier. Now, I know this list may sound overwhelming. 7 screenings, multiple doctor visits, tests, and follow-ups. How do you manage it all? Here are some practical steps. 1. Bundle appointments. Ask your doctor to schedule multiple screenings during the same visit when possible. 2. Use your annual wellness visit. Medicare covers one every year, and it's the perfect time to review what screenings you need. 3. Keep a personal health calendar. Write down the last time you had each test. 4. Ask about coverage. Most essential screenings are free with Medicare. 5. Bring a friend or family member. Having support makes appointments less stressful. Section 10. Living fully after 60. Screenings are not about fear, they're about freedom. Freedom to travel, play with grandchildren, garden, dance, and enjoy the life you've worked so hard to build. Think of it this way: you've spent decades taking care of others, raising children, supporting loved ones, working hard. Now it's time to invest in yourself. These screenings are gifts you give yourself, ensuring that the years ahead are healthy, active, and full of joy. Closing. Thank you for watching Only for Seniors. I'm Dr. Eric John, and it's been my privilege to guide you through these essential health screenings today. If you found this video helpful, please hit the like button, subscribe, and share it with a friend or family member who is over 60. Together, we can spread the word and help more seniors live healthier, stronger, and more independent lives. And remember, your health is your greatest wealth, no matter your age. Take care of it, and it will take care of you. Stay well, stay strong, and I'll see you in the next video.